Infectious disease modeling helps us understand how disease moves through a population. For example, a mosquito transmitting the Zika virus. You have the Ebola virus as well, and several other notable outbreaks that have happened recently. So one of the things that we're going to use to study infectious disease spread is actually measles. Okay, so here's the measles vaccination percentages by country, and we have almost all of them greater than 50%, so not a lot of reds there, but you do have some that are in the 50 to 80%, and then quite a few that are in the 80 to 90%, and then many that are in the 90 plus percent as well. Okay, so we have in this problem, we're going to use measles because there's good data on measles to understand and model infectious disease spread, and then also how to optimize that if you have a limited supply of vaccines. Okay, so we have this problem. Measles is spread through respiration, contact with fluids from an infected person's nose and mouth, and is highly contagious. 90% of people with immunity sharing living space with infected without immunity will catch it. Okay, and you typically have an incubation period of 14 days, and infectivity lasts from 2 to 4 days prior until 2 to 5 days following the onset of the rash, and so about 4 to 9 infectivity days in total. So we want to understand the spread of the measles virus from historical data of major metropolitan areas. We're going to use Bangkok, London, and New York data to help us understand the fundamentals of how this disease spreads through a population. And so this is going to help guide things like public policy, to ban public meetings, travel restrictions, and other measures intended to slow disease until a suitable vaccine may be able to be developed. Okay, so what we're going to do is first of all just start with a couple files, and we'll also, I'll just send you to a reference here. There's a lot of very good literature about this subject. Let's just go to one here. This is estimation of seasonal transmission parameters in childhood infectious disease using a stochastic time model. Okay, essentially what these researchers did is looked at the measles data and then tried to infer these contact parameters, okay, so when school is in session or not in session. So let's just go forward to the model. This is the model we're going to be working with today. So we have S, these are susceptibles, okay, so a population balance of susceptibles. This is our parameter here, which is our contact parameter. So more contact between individuals, it's going to spread more. Okay, so we have the susceptibles and the infected. And so if we increase this contact parameter, then we're going to have a decrease in the number of susceptibles and an increase. So you see, have that same term right there. You're going to have an increase in the number of infectives. Okay, so this is, so if you could think about it this way, here's the whole population. Okay, so this is the population, and in this study, it's about 3.2 million people. Okay, and then we have the susceptible population. Okay, that's going to be, for example, children that haven't already built up an immune response to this, and this is going to be a couple 100,000. Okay, so 200 to 300,000, and then there's going to be a smaller subset of infected. Okay, that where the susceptibles then turned into infectives, and then as this grows, let's say we have more infectives, but we also have some of the susceptibles going to, as they recover, going into the rest of the population. So we have essentially two that we're trying to track here: the susceptibles and the infectives, and these two differential equations are going to help us track that. Just one correction here, we're going to change this N to an I. Okay, that's the gamma is a recovery rate, Okay, so that's the recovery rate, and that is dependent on how many infectives we have. This right here is the number. This is a positive here, so that's going to cause our number of susceptibles to increase. Okay, and this is our birth rate right here. So you have additional individuals entering the susceptible population, and that's through a birth rate. And then these are just the noise or unexplained variations in the data that are going to be the stochastic components of it. Okay, so now we have, let me go forward on this paper. The interesting thing is here is the these beta values right here, and you can see this is the summer holiday. Okay, this is New York City, and so you can see this transmission parameter, which is high during the school year. Okay, but then during the summer break, the transmission parameter decreases. Okay, so it's able to correctly predict that without knowing in advance that there was a summer holiday. Okay, but in Bangkok, we have two main school holidays. And so you can see two dips in this. So here's when school is in session, and then here is when there's a holiday right there. And so you can see it decreases, transmission parameter decreases during these holiday periods. Okay, so this model is able to just infer from the number of measles cases reported what is the contact parameters for each bi-week or 2-week period. Okay, so these are bi-weeks right here. So we're going to take this one step further though in this problem. So we're first of all just going to, in parts A, B, and in A and B, we're just going to basically replicate what was in that paper. Okay, but then we're going to take it one step further, and let's say we had, for this population, we had 200,000 vaccines. Okay, and we have a 3-year period that we can apply those 200,000 vaccines, and we want to try to determine with dynamic optimization what is the best way to distribute those vaccines. Okay, and so what we're going to try to do with part C is add some parts of our equation that help us model the addition of a vaccine, and then in part D, what we're going to do is and then try to optimize that. So let the optimizer choose the vaccination rates, how quickly those are distributed, to best keep the number of cases in a 2-week period, the reported number of cases under 50. Okay, so try to control outbreaks of the disease by taking a smart approach to how you distribute a limited supply of vaccine. Okay, so let's first of all just start with A, and what we're going to do with that is go ahead and just download the files. So go ahead and open up a web browser and just search, if you'd like to, APMonitor Measles, and then it should come up as the first search. And so here's the measles virus spread. Some little bit more information on this model. There you can see, a much longer time period. Each peak is kind of a year there, and the number of cases reported every year. There's an outbreak. Okay, so there's the estimated transmission parameters. We're going to start with these files right here, the infectious disease estimation in MATLAB and Python. So go ahead and download that just to do parts A and B. Okay, so once those are downloaded, go ahead and take those files. Okay, there it is, infectious disease estimation, and go ahead and take those files and extract them. Okay, so there it is. We have our model. Let me just scroll down here. here are the two differential equations that we saw before. Okay, so let's just put those next to the equations that we saw from the paper, and that was right here. Okay, so here are the equations that we have, and then the equations in the model here. Okay, there it is. Okay, so I'm going to scroll down just a little bit. The main equations are right here, where we have the number of susceptibles, the derivative ds dt is the this rate. Okay, so it's calculated up here in the intermediates there, the negative beta times the susceptibles times the infectives, and you know, right here, and then we have the birth rate right there, and then the infective change is going to be equal to the rate of infection minus this recovery rate. Okay, and then the number of cases, we just have a reporting fraction. We just assume that only about 45% of the cases are actually reported, so we're going to try to control the number of reported cases, knowing that that's only 45% of the total cases. Okay, so what we'll do now is go ahead and just run this. You can open it up in MATLAB or Python. I'm just going to do Python for this one and run it, and then once it runs, we're going to see it'll open up a web interface, and then we can see these values. Okay, gamma and beta values. We are not yet estimating the gamma values. Okay, so it's just fixed at you know, this gamma value here. If you scroll over, you can see it's 0.07. Okay, so we want to estimate that as well. This is kind of the recovery rate, and this is assumed to be known, but let's see if we can get a better fit to the data if we estimate this gamma value. Okay, so I'm going to go ahead and open up, let's go ahead and just I guess we can do this here in Python, or you can do it in MATLAB. It's going to be very similar. So what we're going to do is just take this gamma value that's been declared as a parameter, and then just turn on the status. Okay, and so I'm going to do an option and then do gamma status, and we'll set that equal to 1 or on. Okay, so now it's going to try to estimate the gamma value. We can also include upper and lower limits to that. Okay, upper and lower limits. Okay, so let's say we know it can't go above 10, and it can't go below, let's say 0.01. Okay, so just a range of gamma values that we can use to estimate this. Okay, and now I'm going to go and save it, and then let's run it again. This is using a squared error objective, and for part B we're going to change that to an L1 norm objective. Okay, so we have a gamma value there. Okay, so you can see the new val. One thing to consider is that okay, so that was a successful solution. One thing to consider is that okay, so we have this EV type is 2. Okay, right there, that's the estimated variable type. We're going to change that to an L1 norm as well, but let's go back and just see how well we fit on the cases there. Okay, so here are the number of cases that were reported, and there you can see the estimation of this parameter, and the you know, with the new gamma value that's there. Okay, so this is how well it fit with the squared error objective. Okay, so let's change one other thing here. Let's also change the EV type. This is our estimated variable type, and we're going to change it to an L1 norm. Let me just show you a little bit of information about the difference between those two. Okay, so if you come down here to on the dynamic optimization course on estimation and just review the estimator objectives, you Here's a squared error objective that we just solved this with, where we're trying to minimize the difference between the measured and the model values. And then also here's a change, a penalty for the change of that parameter. And then here is a penalty from the deviation of the prior model predictions, and then we're going to solve our differential and algebraic equations. Okay, so the L1 norm objective is right here, where this is like an absolute value of the model minus measured value plus a dead band if you want it in there. Okay, so that's the L1 norm objective and the squared error. And that's what we were changing with this one parameter, which one we were going to use, 1 or 2. Okay, so let's change that to 1 and then go ahead and run it. Okay, and this one is going to run and then come up with the L1 norm objective. Let's just make sure that was successful. Okay, so it took about 4 seconds to solve that, to estimate these beta and gamma values, and then it opened up a new web viewer, and there you can see the value of gamma, 0.164. Okay, so that's the recovery rate of the with the gamma value. Okay, so there is our second one, part B. Now we want to think about how to augment this model. Okay, the model that we had there with okay, so I've got the original rate. What we're going to do is have a vaccination rate. Okay, and we just from some data here, we know we don't have enough. We know we only have clinics to be able to administer about 10,000 per 2-week period. Okay, so that's our one of our limitations. We can't give more of these vaccinations than 10,000 per 2-week period, but we have 200,000 of these that we can apply at any time. Okay, so we have we want to add terms or equations to these population balances to reduce a susceptible population. Okay, and then 1 dose of the vaccine reduces a susceptible population by 1. So you're vaccinating a child. And so we want to write the modified population balance equation, and we're going to use VR for our rate. Okay, so the thing that we're going to do is just say we have a this rate. Okay, this was the minus beta times susceptible times infectives divided by the total population plus the birth rate. Okay, new people entering the susceptible population. And then what we're going to do with the vaccination rate is just subtract. Okay, so if we have this be 10,000 per by week, then that's going to be the slope of this. So that susceptible population is going to go down by 10,000 over a bi-week period. Okay, so we just add this additional term right here. Now we need to do also a balance equation for our vaccines as well. So our vaccines, the number that we have, is going to be equal to the negative of the vaccination rate. So if we just vaccinated 10,000 people, then here is the susceptibles. We also have a vaccine supply, 200,000. And then the next bi-week period, we're only going to have 190,000. Okay, so the way we model that is just include this additional differential equation. And then don't forget to have a lower bound. So the vaccines have to be greater than 0. Okay, so we're going to modify some of our files for this. We'll take our original model here and then modify it to include, we're going to include these one new parameter, 1 new variable, and then 2 additional equation or 2 modifications to the equations. So we're going to first of all just have the vaccine supply, and that's going to be equal to 200,000 initially. That's our initial condition. And there's our vaccine initial supply is 200,000. Okay, so then we also have in the parameter section, we're going to put this vaccination rate, and we're just going to assume it's initially 0. Okay, and then we're going to come down to our equations and just put in here to our equations this minus vaccination rate, and then we'll also include an equation which is dV dt. The vaccine supply is going to be equal to the negative of the vaccination rate. Okay, so those are our modifications to the model for part C. Okay, so now let's come into our, this is our Python file for doing the estimation. Now let's just augment this. So after this point right here, we're going to have, we're going to have estimates of our beta and gamma values. So those are the only things that we want to use for this next phase of let's now change what happened over those 3 years. We just know there are those contact parameters, the beta and the gamma, and we're assuming that those are going to be constant each year. Okay, so for every 2-week period in the year, every first week in January, you're going to have about the same contact period because you have about the same schedule for school and work and vacations and things like that. Okay, so let's then just create a new application. So in this first one, our application was just named Measles, okay, A. We're going to create a new one which is called A2, and this is going to be the control or the optimization. And so we want to, if there's some application on the server with that name, just go ahead and clear it, and then load our model, the same model that we use for estimation, and load the same data file that we used for estimation as well. We're just going to change a couple options here. So we have our parameter gamma, we have a vaccination rate, which is going to be our manipulated variable now. Okay, and then we have these beta values. We'll just set those as fixed values just like we did for the estimation, but we're not going to estimate them. So our status is going to be equal to 0 for those. So this is just a loop to do all 26 of them. We had some predicted values that we might want to see just on the web interface. And then we have our measured values. In this case, the number of cases is going to be the thing that's going to be controlled. The total number of vaccines, the V, is going to be, we want to keep that above 0. Okay, so we have some options. We're going to switch to dynamic control mode, which is 6. We're going to use a L1 norm objective, which is, that allows us to specify a deadband. We have the time units really don't matter here. We can, that's just for display purposes only. We're going to turn off the gamma and beta values. Okay, beta was already turned off up above. Also, we don't want to use the measurements, so we're going to be changing what happens over this 3-year period, so we don't want to use the measurements. We'll turn off the feedback status for the number of cases. I'm going to just include these 4 here. I'm going to turn status on. Okay, so we have feedback status off. We're not going to use the measurements, but we're going to include cases in the objective function. And then we're also going to initialize the trajectory with a deadband. Okay, so if you come back over here to the hints, you can see this TR init, set that to 0, and then you have set point high and low, and that's going to be this black deadband area right here. So we can set, in this case, this was 11 to 9. Okay, and so if it stays within this region, it's going to have no penalty. So in the case of a number of cases, we want a set point high of 50 and a lower bound of 0. So that's the region that we want to try to drive this to. And then we can set the initial trajectory. Okay, so how this, whether we have a funnel, pure deadband, a reference trajectory, something like that. We're going to change that with this parameter right here. Okay, okay, so there's our 50 to 0. Okay, now let's go ahead and insert parameters from the estimation. We're going to grab the new value from the application. That was the application up above. That was named A. This new one is A2. And we're going to insert it as a measurement into this new application. Okay, so we're going to retrieve this value of gamma right here and then just insert it into this, this new application. Okay, and then I'm going to do the same thing for the beta values. I have the status off already. I just did that again. turn on the feedback status. So I'm going to use that measurement. Okay, and then go ahead and grab the beta values. Okay, so I'm just going to get all these beta values and store them in a vector array, and then insert those back into the new application. So kind of like I did right here, where I just retrieved the value and then put it back into the new application. I'm doing that same thing here. Okay, so here are a couple, this vaccine rate. I'm going to turn that on as a manipulated variable. That's going to become a degree of freedom. I'm going to have an upper bound of 10,000. That's how many I can vaccinate each 2-week period, and a lower bound of 0. I can't extract the vaccine from and recover that. Okay, and then I put a cost, just a slight penalty there to say, all else being equal, let's just try to minimize the number of vaccines that we distribute. Okay, and then we have this tuning for the vaccine itself, the vaccine supply. We have a lower bound of 0, a set point high of 200,000, low of 0. We also put some hard constraints on this. So these are more just for display purposes only. Okay, and then we have the status off, so we're not going to be trying to control this in the objective, and I put a pure deadband there just so we could see it from the display interface. Okay, then we want to solve this and then print the output, and I'll open up a web interface. Okay, so that's it for setting up this problem. This was probably the most challenging part of the of this. Okay, so I'm going to come here to the solution, and right here is this file that we were just editing. Okay, so here it is right here, and let's go ahead and just run this. Okay, and as this is running, also direct you to the course midterm files. Okay, the estimation just ran there. It's going to interrupt me a couple times as I do this. But the midterm exam files are right here, and if you want to, you can download the solution files, also post this video right here. But all the files that we're working with here, they're under problem 3 solution for infectious disease. And you can also see the exam is right here, midterm exam, and if you just scroll down, this is problem 3 that we're currently working on right here. Okay, so that's it. That's let's go take a look at our solution then. So here we had our value of gamma. That's good. We got correct value from the L1 norm estimation. But now we want to look at the number of cases from our optimization. So we try to keep this under 50. There's our upper bound of 50. And let me make this just a little bit bigger so we can see it. So initially we still had that first peak. It got up to 300 reported cases, but then it decreased them, and then was able to keep it within this deadband. Okay, and then let's go and take a look at the number of the vaccine rate that okay, so there's all our gamma and beta values. If you just select this link right here, it'll bring up the plot up at the top. Okay, so here's the vaccine rate right here. So it went to 10,000 initially. That's 300 cases were too high, but it could only go up to 10,000 for the first 13 2-week time periods. And then the clinic said, well, now we can go down to just 630. Okay, and then right at the end, we needed to go back up to 2,400 vaccines per 2-week period. Okay, so let's see what that did to the vaccine supply as well. If you scroll down, looks like my browser's acting up here. But if you look at the number of vaccines there, go ahead and select the vaccines. You can see the supply there. Okay, so we had kind of two different periods here where we were using 10,000 per bioweek period, and so you can see our vaccine supply gets down to about 70,000. And there you can see we had a much lower rate of consumption, and then at the end we got down to about 12,000 left. Okay, so let's look at our susceptible and our infective populations as well. Here's our susceptible population. Okay, and let me see if I can just make this, okay, go full screen. So our susceptible populations, we vaccinate, that goes down, but we still have that birth rate that wants to bring it back up. So once we reduce our susceptible, our vaccination rate, our susceptible population goes back up, and then it levels out. Okay, so it said this is the best profile to follow to keep outbreaks from occurring. So essentially you've reduced dramatically the number of susceptibles, you let it climb a little bit, and then let it level out again. This is the way the optimizer says to control the outbreaks. Okay, and let's do, let's just look at one more, the infectives. Okay, so we can't cure the infective population directly. We can only reduce the susceptible population, okay, with these vaccines. But by reducing the susceptible population with that very strong vaccination program at the beginning, the number of infectives drops, okay, and then stays fairly low for an extended period of time. Now, in order to completely eradicate this, you would have to have an increased supply of the vaccine and a higher vaccination rate. So here it's about 50% overall, but you'd have to increase that to a higher fraction in order to eradicate this disease from the population. Okay, so that concludes this tutorial on and this solution for the infective disease population. There are a number of these tuning parameters here that are, I'd encourage you to go back and review these objective functions here and what each of the terms do. There are, some very particular things that you can do to really change the solution or get the kind of solution you want. And so go back here and review the different objective function forms.